Okay, it seems like we're all connected, so I just want to say hello and welcome, bienvenue to the CanCOVID speaker series. It is Tuesday afternoon at 4 p.m. Eastern. We are joined today by Jim Dunn, who's going to share his insights about housing. We will have time for questions after his presentation is done. You can feel free to put your questions in the chat box or turn your video on and ask yourself and have a conversation. So without further ado, Jim, take it away.
Oh, great. Thank you so much. Lovely to see all the familiar names on the tiles. Um, you know, we no longer see familiar faces, and this is another sign of the times that thought I would share that's very seasonal as well. I just figured it needed a bigger audience, this picture. Um, Thanks very much for having me. These are some kind of high-level thoughts about a bunch of things related to housing. I'm not sure that they have a ton of internal coherence, but like I said, they're all related to COVID and housing. Um, so, what does COVID-19 reveal about the future? And so, I've got 8 things I want to talk about. First is homelessness and infection control, a transition to more permanent housing solutions, particularly for people who are homeless and underhoused, issues around temporary quarantine housing, some implications of the pandemic that have, or essentially, the pandemic has made the implications of housing, long-term care, and an aging population even more acute and visible. Well, I'll talk briefly about mortgages, evictions, and housing precarity. Essentially, just some things to look out for because the situation is not yet clear. Some housing threats post-recession, issues around housing stimulus and economic recovery, and then some issues around housing recovery and gender. So homelessness and infection control, it's good to start with this because very, very quickly after the beginning of the pandemic and after it was declared a global pandemic and things like lockdowns and so forth started here in Canada, many people in the homelessness, public health, and sectors quickly recognized the risks in shelters. So people who are homeless and underhoused were at very severe risk for outbreaks because physical distancing is impossible in shelters. And around that same time, there was and of course, shelter users are vulnerable for a number of reasons, not the least of which is that they often have other kinds of underlying conditions. And so around the same time, there was a global collapse in hotel occupancy. And so municipalities quickly moved in a number of places around Canada to acquire unused hotel rooms, in some cases rentals, in other cases purchases, actually long-term. So City of Victoria has actually purchased 2 hotels for longer term housing that they intend to use ultimately for longer term housing. City of Toronto acquired 3 hotels for 2 years. City of Hamilton, I know, has acquired a number of hotel rooms as well. They also, a number of municipalities, Hamilton included, started up more open shelter space. And in Hamilton's case, it was in the large arena, on the floor of the large arena. This was aided, so there was a remarkably few cases ultimately from shelters in any Canadian city, which is in a way incredibly surprising. And in part, this is due to some very aggressive and tactical testing strategies and a lot of smart people who were very, very highly committed. I know the group in Hamilton, the Hamilton Shelter Network, Shelter Health Network, were incredibly successful in this area. So this is one of the big issues, and it's something that's not going to go away. So this is something that remains an ongoing threat, and so it's something that we can't stop thinking about and have to continue to be vigilant about. Now, what's interesting is, interesting to me at least, is that many municipalities have leveraged the crisis for new funding for permanent housing. And I suppose, this is consistent with the old phrase, the old saying, never let a good crisis go to waste. But this has mostly been aimed at homeless and underhoused people. And in part, again, I'm not really, as you'll see at the bottom, I'm not really sure we can attribute this political shift to, because it's kind of hard to pin down. But there have been a few instances. Toronto has a site in Scarborough where they're going to build modular housing quite quickly. that has received a lot of attention. And by modular, I mean actually relatively long-term housing. It's not completely permanent. It's designed to last sort of 4 to 5 years. Victoria, as I said, has previously has acquired 2 hotels, and they paid actually a pretty heavy price per unit for those, which was somewhat surprising. But other places have seen new investments as well. So there's been a widespread new interest in housing people who faced challenges related to homelessness under housing. By no means is it fully sufficient, but it's still been a kind of a really interesting shift. As I say, not enough or fast enough. And in fact, at the same time that this has been happening, we've seen homeless encampments become a big issue in a number of cities. And so the good news about that, I suppose, in a sense, is that it's actually put more pressure on municipalities and governments at senior levels as well to come up with permanent solutions for permanent housing. We have some well-established models that have been widely tested, and I'm thinking in particular housing for people with severe mental illness and addictions. There's a model known as the at-home chez soi model, which was a randomized trial in 5 cities across Canada, and the at-home chez soi model is easily adapted. It's one of the tricky things, actually, though, is getting it integrated with medical supports and particularly assertive community treatment teams that have to be run through interdisciplinary psychiatric units. So that's what we've seen in terms of a transition and an increased interest in permanent housing. And essentially, these are things that people in the sector thought they were still going to have to fight for another 5 to 10 years. And all of a sudden, in an instant, they were on the agenda. Some of this might be motivated by a kind of broader self-interest. And certainly the early days of the pandemic and the interest in permanent housing for people who faced housing challenges was reminiscent for me of Friedrich Engel's book, The Housing Question of 1872, and in particular this quote where he said, "The so-called poor districts in which the workers are crowded together are the breeding places of all those epidemics from which time to time afflict our towns. Capitalist rule cannot allow itself the pleasure of creating epidemic diseases among the working class without impunity. The conses must fall back on it, and the angel of death rages in its ranks as ruthlessly as in the ranks of the workers. As soon as this fact had been scientifically established, the housing conditions of the workers were examined in attempts to remedy the most crying evils." So this quote actually seems remarkably prescient of the current situation with the pandemic. As soon as people who were homeless and underhoused became threats of being disease vectors for the broader population, suddenly there was an intensified interest in providing permanent housing solutions for them. But don't call me cynical. So another issue related to infection control, which is really important, but sadly and surprisingly, unbelievably timid reactions to this, is temporary quarantine housing. This is something that was used in Wuhan province incredibly aggressively from a very early stage, essentially because secondary household attack rates, in other words, if one person in a household gets COVID-19, the odds of them passing it on to someone else in their household is between about 1 in 5 and 1 in 3. And so it's incredibly high household attack rates. And so they recognized this very quickly in Wuhan province, and it was actually mandatory. People who were diagnosed with COVID, if they didn't live alone, if they lived with any other people, they were actually required to use temporary quarantine housing. So, the underlying logic in all of these things is breaking chains of transmission. It's believed that we really only have anecdotal evidence of this. We don't really have strong systematic evidence of this, but we certainly have strong evidence of high COVID-19 rates in Northwest Toronto, Peel, and other suburban high-rise areas in particular. We have evidence that there are very high rates, and it's partly, we think, that due to an inability to self-isolate at home. In other words, somebody gets COVID, they live in often a multi-generational household without a lot of bedrooms, without a separate space where they can easily self-isolate for the duration of a quarantine period. and that's something that's actually exacerbating the secondary transmission within households. So this is a big enough issue that Toronto, in late July, the staff got got direction from council to negotiate with the feds to establish a voluntary quarantine facility. As I mentioned before, the city has already acquired all of these hotel units, and in fact, some of the hotel units were sitting empty. They've essentially paid for them, and they're sitting empty. And so they received almost $14 million from the feds for a voluntary quarantine facility. And this has been done in other cities, including New York City and Chicago. There's still a lot of questions about how to operate such facilities to make the experience convenient, equitable, and comfortable in the communities that we really need people to use them. There are issues of language, trust, issues around income replacement and job security, and as well as caregiving. So if, for instance, someone is the caregiver for an older person in their household and they contract COVID at work and they don't want to pass it on to their family member, they can't go away for 2 weeks and just leave the caregiving responsibilities unfilled. And so, those are some of the kinds of things that need to be addressed in operating those kinds of facilities. And the truth is, I just don't really know very much about how they're being operated and how those issues are being dealt with. I'm actually in the process of doing a review of any documents we can get from around the world about about operations of temporary quarantine housing, and I'm working on that with Michelle Wyndham West from OCAD University. So moving on to the next topic, which is housing, long-term care, and aging. So I think it's widely understood, and there have been several thousand deaths related to the huge problems in long-term care and retirement homes. And my view is that in addition to needing to deal with those in a very immediate way, it's also indicative of a larger problem related to housing and aging. And I've been talking about this particular problem for for a couple of years now. And in particular, I'm worried because the 80+ population in the Greater Golden Horseshoe, as well as in other areas, and by Greater Golden Horseshoe, I mean from kind of Ajax all the way around to Niagara. That population is estimated to grow from 350,000 to over 1 million by 2041. So it's actually an extra 700,000 people over the age of 80. And at the same time, even prior to the pandemic, there was a huge concern about alternate levels of care. So essentially people who end up in a hospital who don't belong there, and also the ability of long-term care beds to meet the population need and so forth. And to me, these are all housing problems. And there's effectively, the way I think about it is there's a continuum from on the one hand, the single detached dwelling in the suburbs is a combination of accommodation and support. So all housing, as well as hospitals, jails, long-term care facilities, et cetera, they're all housing because they're configurations of accommodation and support. The detached dwelling in the suburbs provides accommodation, but there are also supports provided. Somebody comes and takes the garbage away, clean water is supplied, someone takes, the sewage is taken away, et cetera, et cetera. So there's supports associated with that. And then at the other end of the spectrum, an acute care hospital is also housing plus support because it's accommodation. People spend the night there. And in addition to that, it's acute care supports that are provided. And so now what happens with alternate levels of care is essentially they end up with a number of people in hospitals who are in hospital but don't belong there. So they're they don't need acute care supports, but there's really nowhere else to send them. And in some instances, they end up in long-term care facilities, often prematurely and unnecessarily, because there's nowhere else to send them. So ultimately, this is a broader issue around more innovation and supply of housing for aging in order to maintain independence. And we often talk about aging in place, but aging in place can actually mean that people are stuck in inappropriate accommodation, often in car-dependent suburbs where they may no longer be able to drive, And that actually is an environment where they might be unable to maintain their independence for as long as if they were in a more compact, transit-oriented kind of environment. So those are the kinds of things that we need to be thinking about as we move into the future, and a more integrated approach that builds in purpose-built options for people's wherever they happen to be in the housing career, the life cycle relationship to housing, that's not just a single family home and an institution. So the way I think about this is from a life cycle perspective. And in the housing world, we talk about people's housing careers. And the pinnacle of the housing career in many parts of Canada is that you, for at least a large portion of the population, is that you get the detached ground or semi-detached ground oriented home, often in a suburban car oriented kind of environment. And the difficulty with that, that used to be a model that was perfectly good. And in the previous days, a very small minority of people would outlive that. So essentially, it was a model was get that detached or semi-detached, ground-oriented, car-oriented home, often in a suburban environment, and cling on to it until you die, essentially. And a very small minority of people would outlive it. And those people who outlived it were a very small number. But as the aging population grows and as lifespans increase, we're going to see a growing number of people who outlive that form of housing, that pinnacle of the housing career. And so we need more options for those folks. And we need to think about these innovative kinds of approaches that will combine the right kind of accommodation with the right amounts of supports in ways that can be delivered efficiently. So anyways, it's a longer conversation. And this is just reflective of that. This is an article from 2016, which says our infrastructure fails seniors who don't drive, and that's a problem for everyone. Okay, so the next topic is around mortgages, eviction, and housing precarity. And I'm going to conclude with all of this to say that the jury's still out exactly on what the long-term effects or even medium-term effects are going to be. But just by way of sort of situating the issues, the federal government and the Bank of Canada acted quickly to prevent mortgage default disaster. The banks granted 795,000 deferrals, which represented 16% of the mortgages that the banks had on the books, residential mortgages that the banks had on the books. But we don't know yet how many people will ultimately default. So the deferral protection has now ended, and the banks are now saying to people, you have to start paying your mortgage again, but it's unclear exactly how many will default. For those of you who don't know what a deferral is, it's essentially it's not so much that you don't have to ever pay. They just take the interest that you would have owed. Say you got a 4-month deferral, they add up the interest that you would have owed in each of those 4 months, and they just add it to the overall value of your mortgage. So you just have to pay over a longer period of time. Provincial eviction moratoria has protected renters initially, but it's now largely over. And in Ontario, it appears that there's even less protections for renters from eviction. There's new legislation that the provincial government has put in place that makes it easier for landlords to evict tenants. It's not clear what the impact will be. There will unquestionably be evictions, and they will be to people who are vulnerable and don't have a lot of other options. So this is definitely going to be tragic. I don't know what the scale of the impact will be, because many landlords are going to figure out that if they impact the tenant they have, that they might have a difficulty in finding another tenant. And so hopefully what's going to happen is that in a number of instances, they'll make deals with their tenants in order to retain them, and in a way that's affordable. So I'm cautiously optimistic that it won't be as bad as it could be. So overall, the housing precarity situation is still quite unknown, in part because the CERB has just ended only recently. So at the same time, from a market perspective, rents in Toronto and Vancouver and the larger markets have been decreasing, and in some cases pretty significantly, in part because of reduced demand from students, international students, reduced demand from short-term rentals and so forth. But then there's a whole other class of mortgage holders who I've called specuvestors. So these are investors who are investing in rental properties purely for speculation. A number of them actually do so with a planned underwater property. In other words, they buy a condominium unit. It's not cash positive, it's actually cash negative. So they actually pay uh, um, some amount monthly out of their own pocket in order to keep the unit afloat, and they hope for some speculation in the future. That many of them are in very tight situations. They're having difficulty making their payments. They're having difficulty finding tenants. Certainly, if they were in the short-term rental market with Airbnb and so forth, they're finding difficulty in finding the same revenue on a monthly basis that they had previously. And so I think this is an area we can definitely expect some defaults and some actually pretty tragic financial circumstances for people. In terms of thinking about housing threats after the recession, housing affordability was already a huge issue in Canada pre-COVID. As of 2018, median home value to income ratios were already quite high in big cities, and here's a smattering of those. They ranged from 9.1 in Vancouver to 3.1 in Halifax, 2.4 in Halifax, 3.1 in Ottawa, and Toronto almost 6. In some submarkets, for example, Vancouver's North Shore, the ratio is as high as 20 to 1. So house prices have seemed to be rising, however, during the pandemic, which has been somewhat of a surprise, especially in suburban, peri-urban, and secondary markets. In part, that's driven by people are trying to get out of the GTA. They think that they're going to be able to work from home forever, perhaps, and want more space. Are happy to kind of get away from some of the challenges that Toronto faces right now. I'm not sure if the same thing is happening in other larger cities in Canada, but certainly it's a big factor in the GTA and in Ontario. So the challenge, of course, is that in the markets they're moving to, and people were already moving to these markets. So we were already seeing outward migration from the GTA into markets like Woodstock and London and other areas in North and Southwest Toronto, Northwest and Southwest Ontario. And so we were already seeing affordability challenges, but now the affordability challenges are even greater because at the same time that there's this increased demand coming from people who have a fair bit of equity built up in their homes in the GTA. We're also seeing a shortage of used inventory in those markets. So I've been following Hamilton pretty closely, and the inventory is getting snapped up very quickly. There's multiple offers and bidding wars and so forth that are happening, and prices are going up pretty rapidly. So this is creating new challenges for housing affordability in these markets, these secondary markets. And then another big threat is financialization from large global investors, and including real estate income trusts. And this is a major threat. So after the last recession and from the global financial crisis in 2008, 2009, one of the things that happened is a number of very large investors, both domestic and global ones, went looking for quote unquote underperforming properties, rental properties. And by underperforming, they essentially mean we could fix these places up and get higher rents. And so this was something that happened from 2009 through to the mid 2015 kind of area, and continues to happen, is purchasing these large investors purchasing buildings and then using a variety of tactics to try and get the existing tenants to leave. And we can go into the details of that in the discussion, and then raising the rents. And so the challenge with this is that anybody who's familiar with housing markets will know that the vast majority of affordable housing is not provided by not-for-profit groups and the public sector. It's actually provided by private market housing. So when you have these private market units that were previously reasonably affordable go into the hands of these investors and then get upscaled, it actually takes away a lot of units from the available units that are affordable, and they're lost forever. Now, one thing that the sector has been calling for quite some time, even prior to the pandemic, is help for not-for-profits and municipalities to be able to buy these properties before the private sector does. I'll give you an example of how this works. There was a building that was actually the subject of a rent strike in Hamilton, in the east end of Hamilton, in an area called Riverdale, and it was a market building, and it was a REIT that had purchased it, and they were had been approved for a number of above guideline rent increases. So it's actually a rent controlled building, but they got above guideline rent increases. So the guideline around this time was around 1.8% per year, and they were getting 3.5% and so forth, which doesn't sound like a lot of money, but it actually translates into, when incomes are stagnant, it actually translates, and incomes are low in these households, it translates into actually a pretty big increase in housing costs. The one building in Riverdale that one of the REITs bought, they purchased for $163,000 per unit. And this at a time when new construction of multi-unit housing was about $300,000 per unit. So essentially they're buying almost 140,000 below the cost of replacement. And so if the not-for-profit or municipal sector had been able to buy that building, they could have put $50,000 per unit in, which would be an enormous amount of money, and still been $90,000 ahead of the game, almost probably about 30% below what it costs for new construction. So actually today, CMHC announced a rapid housing initiative, and it's $1 billion half of which will go to not-for-profits, half of which will go to municipalities, and it will allow them to be able to capture some of this, the stock before it gets financialized and into the investment market. Now, housing is also a site typically for post-recession economic recovery stimulus. So the typical stimulus focuses on infrastructure to compensate for private declines in investment, job creation, and so forth. And that's certainly what happened after the recession from the financial crisis. But the recession in COVID-19 has actually been very different from past recessions, and the declines have been focused in services, and mainly due to a massive collapse in aggregate demand. And the typical stimulus measures won't impact service sector workers. So this is actually quite a dilemma. Governments are prepared to cut big checks, but they can't cut them in the ways that they would normally do so. And so it's actually a really challenging puzzle to try and figure out what they're going to do. At the same time, action on housing is needed, but it's going to be difficult to find a way to translate that spending into a workforce that's not previously in the sector. There's many barriers. In other words, right now, even prior to the pandemic, there was a labor shortage in construction and housing construction. Costs were going up very, very quickly in terms of both materials and in labor. And so putting more money is not actually going to create more housing, and it's also not going to create more jobs for the people who've lost their jobs, unless something's done. There may be a role, and this is my personal hunch, for modular and manufactured housing, because one of the biggest challenges in the construction industry is that a lot of the work a lot of the jobs that are there are trades, and so it takes a long time for somebody to get into the trades and then be fully trained in the trades. And it's possible that manufactured housing, which is built essentially on the floor of a factory, might be able to skill people up in order to be able to take jobs in that, and that would ultimately produce housing, which is what government should want to be spending on. So the workforce could be trained faster, and then the housing could be built faster, and the jobs could be directed to the workforce that has lost jobs in the service sector, and who otherwise would have faced barriers to getting into that sector in the past. So the last thing I want to talk about is housing recovery and gender. So housing is a highly gendered site of everyday social activity in a whole host of different ways. And there have been many issues with the collapsing of work and home that have fallen differentially across gender, and issues around paid and unpaid work and gender, of course. But and then some acute problems related to intimate partner violence and housing options for people who are trying to escape intimate partner violence, coupled with the stresses of the pandemic, making intimate partner violence situations even more dangerous. So this is a big issue that a number of organizations are facing right now. Issues around caregiving and work from home, so that we have to find some way for both economic reasons and social reasons to have safe childcare. But the one thing that I want to talk about that's sort of specific to related to the housing market is that the job loss in the recession is not only in the service sector but also highly gendered, and in fact, many commentators have been calling it a she-cession, not a recession. So the typical stimulus, as I said before, won't impact this. And again, this might be a role for manufactured housing and an opportunity for us to sidestep barriers and time to entry to traditional trades-based occupations. And at the same time that we get more jobs into that sector and more labor into that sector in order to meet the demand from that is both coming from the market as well as additional stimulus demand, then we may actually there may be an opportunity there. So that's the 8 things that I wanted to raise. And honestly, I'd be really some of these things are quite uncertain in terms of their future. Some of these ideas are kind of preliminary from my perspective, and I'd be really interested in hearing people's thoughts and questions from this. So thanks very much for your attention.
Thank you so much, Jim. So we've taken up the allotment of our time. So if people do have questions and could stay a few minutes over, please feel free. I did get a question from Michael Widener, who was curious. Can you speak to the geography of crowding density and COVID safety protocol compliance?
Depends what you mean by COVID safety protocol compliance, Michael.
Hey, can you hear me?
Yeah.
Yes.
Yeah, I was just curious about issues of like that. I understand the differences between crowding and density, but thinking about the ability of folks to maintain sufficient distance between each other in buildings with elevators and those without elevators, and the sort of multifamily homes, et cetera. Does that sort of clarify?
Yeah. So, I mean, I think that's certainly an issue. And municipalities are actually just now in the process of amending bylaws and other sorts of orders for mask wearing to include the interior of multi-dwelling or multi-unit dwellings. So yeah, I think it's certainly important. I mean, the difficulty with these things is in principle, sure, you could, because it's airborne, you could transmit COVID to somebody during an elevator ride. But on the other hand, we don't have a lot of evidence of that. So a lot of the evidence that has been accumulated related to transmission and in certain kinds of contexts is all kind of anecdotes, right? So the one I'm thinking of in this particular instance is the call center in South Korea, in Seoul, which was something that was widely publicized in the media, where there was a call center on a single floor of an office building, and everybody on the index cases side of the floor got it, or a large proportion. A couple of people on the other side of that, on the other side of the elevator bank, got it on the same floor, but nobody else in the building got it. And so that would suggest that there wasn't a lot of elevator transmission. I think it's sensible for us to be precautious. Wearing a mask is not a great burden, and to wear a mask inside an elevator and limit the occupancy, I think is not a great burden. Of course, achieving compliance is challenging. You need landlords to get on board, and condo associations and so forth, as well as the occupants of those buildings. So, all of these things are a number game. Let's not let the perfect be the enemy of the good. Any reduction in chains of transmission is a good thing.
I think that's a brilliant answer, and I love that phrase. Let's not let the perfect be the enemy of the good. I thank everyone
This
so
is
much.
true ever more in COVID than anywhere else, I would say.
If there was a COVID emblem, I feel like that should be a part of it. I want to thank everyone for coming today, and I just wanted to take a quick moment to say thank you because I have so enjoyed this speaker series. This will be I'm moving on from CanCOVID. This is my last week and my last speaker series, but you will be in the very capable hands of Chloe Payne. And I just wanted to take a moment to introduce Chloe Payne. Chloe, if you want to take your video on and say hello. So Chloe will be hosting you starting next week. And you'll be in very capable hands and listening about COVID applications and contact tracing with Emily Sato. So if you need to contact me in the future, please don't hesitate. I will be remaining with the University of Toronto, so my same email address, Kimberly Colburn at utoronto.ca will work out. So thank you so much, and best to everyone.
Thanks, Kimberly.